So remember, our appendicular skeleton is made out of girdles, okay, and the limbs. So the upper appendicular, we can concentrate on the pectoral girdle, okay. This attaches the upper limbs to the trunk. So that's actually our topic today. Now, the pectoral girdle is made out of the clavicle anteriorly and the scapula posteriorly. So if you take a look at it from the top view, the clavicle and the scapula would actually create some kind of a letter V, okay, on top view. And then your humerus is going to be attached to the lateral side of that girdle. So this is going to be the clavicle, which is going to be the anterior part, okay? And then this is going to be the scapula, which is going to be the posterior part, okay? And that is what the girdle would be for the pectoral girdle. Now, the medial end of the clavicle attaches with the sternum through what we call the manubrium, okay? And then the lateral part ends at the clavicle and joins with the scapula. So the lateral part is here between the clavicle and the scapula. And then the scapula do not join each other or the atrial skeleton. So the scapula is floating at the back of your body. It's not attached to anything at the posterior side of your body. So it's floating. You can actually move your scapula if you keep on moving your arms, okay? So you can actually move the scapula if you keep on turning your arms backward. Now this is going to be attachment for muscles, move the upper limb. So that's very important when we study the muscle. The girdle is very light and upper limbs are mobile, okay? The clavicle articulates with the atrial skeleton through the sternum, and the socket of the shoulder, which is going to be the humerus bone, would actually articulate with the cavity on the lateral side of the scapula. That cavity is called glenoid cavity. So it is good for flexibility, but bad for stability, because if you notice that the head of the humerus sits narrowly on top of the glenoid cavity. So it's not a fit, it's not an exact fit into that cavity. So you can easily dislocate that arm, okay, at the humerus. So it is good for flexibility, but bad for stability. So this is a picture of the clavicle, okay, and the scapula is located in the posterior part of the body. So both articulates on each other at the lateral side, and the clavicle articulates at the sternum. Now, if you take a look at the clavicle, okay, the sternal end, the one that articulates the sternum, that articulates with the manubrium of the sternum, it is flat. So you see it's actually blunted portion of the clavicle. And the part of the clavicle that articulates with the scapula, it is wide and flat. It looks like the the beak of a duck, okay? So this is how you can differentiate the ends of that clavicle. So if you take a look at the flat end of the clavicle, that's going to be the part that goes into the sternum. So we call it the sternal end, okay? If you go to the lateral side of the clavicle, you can actually see it's flat. It looks like a duck's beak. That goes to the scapula. And what part of the scapula exactly? It's called the acromion, okay? It articulates with the acromion. So we're going to identify that on the scapula later on. Now, these are the two structures that you need to identify in the clavicle, which is the sternal end and which is the acromial end, which is at the shoulder. Remember, we talk about body orientation, we talk about the shoulder as acromion, okay? That is the acromion. Now, at the inferior part of the clavicle, we have this process that projects downward. So it projects downward posteriorly, and that is called the cunoid tubercle. So if you see the cunoid tubercle, you're looking at the inferior side of the clavicle, okay? So the cunoid tubercle is part of the clavicle, all right? And then we're going to take a look at that clavicle. There's a lot of attachment of muscles there when we take a look at the muscles. And it holds the scapulae and the arms laterally, and it transmits compression towards the axial skeleton because it's the one that it's articulating with the sternum. Okay. Now, the scapula is located at the dorsal surface of the rib cage. That's between ribs 2 and 7. It has 3 borders. We call it the superior, the lateral, and the medial border. And it has 3 angles. We call it the lateral angle, the superior angle, and the inferior angle. The scapula is this picture here. Now, you see that the anterior side of the scapula, this is flat. Okay? So that would be a fossa. It's a flat depression at the anterior portion. We're going to call it subscapular fossa. Okay? So the subscapular fossa is flat. Okay? It's not separated by any other structure. Now, take a look at this part here of the scapula. That is the medial border. And the part that's located here, that is the lateral border. And the part that's located up here, that is going to be the superior border. So it actually tells you the position of the scapula in the person's body. So anything that you see here, the lateral side, is where the head of the humerus will articulate. So the head of the humerus articulates on the lateral side through this cavity. This cavity is called the glenoid cavity. That is the glenoid cavity where the head of the humerus articulates. So it's on the lateral side. Okay. Now there's 2 processes on the superior border. One is located at the anterior portion of the scapula, and that process is called the coracoid process. That's called the coracoid process, located protruding anteriorly of the scapula. There's one that protrudes posteriorly of the scapula. That is going to be called the acromion process. Okay, it's more visible on the posterior side of the scapula. And then there's a notch at the superior border. In the notch of the superior border, since it's above the scapula, we're going to call it suprascapular notch. Remember, we name structures based on location. So the word supra means above, scapula, and it's a notch. So we call it suprascapular notch. Okay. So these are the structures that we see at the anterior portion of the scapula. And at the corners, you can see the superior angle, inferior angle, and the lateral angle is actually going to be right here. Okay, we got borders and angles. So it's actually telling you how it's actually located at the part of the body. Okay. So we finished with the anterior portion, okay? And one other thing that you will remember that when we talk about muscles, we're just using the name of the muscle based on the name of the bone. Since this is called the subscapular fossa, the name of the muscle that is actually sitting on that portion is just the subscapularis muscle, okay? Because we're actually just using name of the area of the bone. The subscapular fossa has the subscapularis muscle. Okay. Now let's take a look at the back of the scapula. Again, orient yourself, superior border, lateral border, and medial border. We have the angles, superior angle, inferior angle, and the lateral angle. So you know that this is actually the place where the head of the humerus will articulate at the lateral side. So the structures that we see here is actually the structures you see in the front, except that at the back, instead of one fossa, I have 2 fossas at the back. So I have 2 fossas at the back. It is because it's separated by a spine of the scapula. This is called the scapular spine that separates the 2 fossas at the back. This is called the scapular spine. Now, if you notice, at the end of the scapular spine is the acromion process. So that's actually at the end of the scapular spine. That's called the acromion process. And the one located in the front of the scapula is called the coracoid process. So this is going to be the coracoid process here, and this is the acromion process at the end of the scapular spine. Okay? So again, is the same name as we said that this part here on your it's going to be your shoulder, right? Because of the acromion process of the scapula, which is the end of the scapular spine, right? Okay, so now we know the processes. Now let's take a look at the fossa. Since there's not a single fossa here, it's divided by the spine of the scapula. We're going to name the fossa based on the location where it is compared to the spine. So this part of the fossa that's above the spine is called the supraspinous fossa. So they'll tell you that it is above the spine. So the fossa that is located above the scapular spine is called the supraspinous fossa. The fossa located below the spine is called the infraspinous fossa. So take a look at the word supra and infra. Supra means above, infra means below. So there's a spine in between them, so we call it supraspinous fossa above, infraspinous fossa below. Okay, this is located in the posterior aspect of the scapula. Now, again, when we study the muscle, we're naming the muscle that sits on the infraspinous fossa. The name of that muscle that sits here carries the name of that fossa. We call it the infraspinatus muscle. Okay? So it's not complicated. We actually just use the name of the part of the bone where this muscle sits. So we call it the muscle in the infraspinous fossa. It's an infraspinatus muscle. So what do you think is the name of the muscle that sits on the supraspinous fossa? That would be the supraspinatus muscle. Okay, it makes sense now, right? So we just carry the name of the muscle based on where it's located on the bone. An example for that later on, you'll see that the muscle, the temporal bone, is a temporalis muscle. The muscle on the frontal bone is a frontalis muscle. So it should not be as complicated as you think. Anatomy is actually based on the location, okay? So we have the two fossas located here, and we can still see the notch, okay? We call it above the scapula. That's why we call it suprascapular notch, okay? Just remember the processes. The coracoid is anteriorly, and the acromion is posteriorly, okay? And the acromion process is the end of the scapular spine, okay? And again, the head of the humerus is articulating at this cavity, and that cavity is called the glenoid cavity, okay? So those are the structures that you need to identify on the scapula, okay? So we're done with that scapula. If you actually take a look at the lateral view, it's showing you where the processes are located at, and the glenoid cavity. So the glenoid cavity is a cavity in which the head of the humerus sits, okay? That's where the head of the humerus sits, and that's the reason why you can actually move your shoulder, okay, with the humerus, okay? So the processes would be the acromion at the posterior end, okay? And the anterior end is going to be the coracoid process, okay, at the anterior end of the scapula. Okay, so that was your scapula. We did the clavicle. The two articulates on the lateral side. We call those two bones pectoral girdle. So we call it pectoral girdle. Okay, so those are the two bones that holds the upper limbs, the pectoral girdle, the scapula and the clavicle. Now let's go down into the upper limbs. We're going to divide the upper limbs into the arm, the forearm, and the hand. Okay, the arm is actually made out of one bone called the humerus. The forearm is made out of two bones called the radius and ulna. And the hand is going to be the wrist, the palm, and the fingers. And what are the bones in the wrist? We call it carpals. And the bones that are covered by the web of the hand, which is the palm, we call it metacarpals. And the fingers, we're going to call it phalanges. Okay? And that's actually what we need to know about the upper limb. Okay. So we're going to start off with the humerus. Okay. The only bone of the arm is going to be the humerus. Now, if you take a look at the architecture of the lower extremity, they're going to be the same. One bone on the thigh, which is the femur, and there's one bone onto the arm, which is the humerus. Two bones on the leg, the tibia and fibula. There's two bones on the forearm, the radius and ulna. And you got carpals, the wrist. On the ankle, you got tarsals. And then at the web of your hand, we call it metacarpal. On the web of the sole of your foot, we call it metatarsal. And the fingers all are called phalanges. Okay, they have the same architecture. And whatever process that projects out from this bone, they're very similar to what you see in the lower limb. Okay, they have the same architecture. So the longest and strongest bone of the upper limb is the humerus. This one articulates at the scapula through the glenoid cavity of the scapula. So the glenoid cavity articulates, the humerus articulates with the glenoid cavity of the scapula. And then at the distal end of the humerus is the two bones called radius and ulna that articulates at the elbow, and that is the two bones of the forearm. Okay, so this is what our humerus is going to be. And remember, there's a lot of muscle attached to that. Okay, and other structures of the humerus provide articulate sites for other bones. Okay, now this is what this humerus would look like. Okay, now the trick about anatomy is to get a landmark. So you will actually start from the landmark in order to determine, are you looking at the anterior, posterior, lateral, or medial? Okay. The thing about the humerus is you can actually assume that the head of the humerus is the one articulating at the glenoid cavity. So if that head is articulating the glenoid cavity, you know that this is going to be the medial part of the humerus. So opposite to that is going to be the lateral part of the humerus. Now, how do you know this is the posterior view or the anterior view? So I'm going to use a landmark at the distal end of the humerus. So differentiate this to distal end of the humerus. At the distal end of the humerus, there's only one fossa at the posterior side. Only one fossa. But if you take a look at the anterior side of the humerus at the distal end, there's two fossas there. Okay, so I'm going to use this single fossa that is located at the distal end so that I can know this is the posterior view, and this one with two fossas, this is going to be my anterior view. Okay, so the main thing about anatomy is to know which is the anterior, the posterior, the medial, the lateral, the proximal, the distal. Okay, so this is going to be at the distal end. Okay, and this is going to be at the proximal end because the proximal end articulates with the shoulder. Right, so I got my directions: proximal, distal, medial, lateral, anterior, posterior. So I'm going to start identifying structures that I see on the proximal end at the posterior side. Remember, this single fossa is my landmark that I'm looking at the posterior view of the humerus. So the first thing is the head. So I have the head of the humerus, okay, the round ball that articulates with the glenoid cavity. And then I have two necks. The first neck is just beneath the head. That is called the anatomical neck. And then I have another neck that is actually along the axis of the humerus. That is called the surgical neck. Okay, these are the two necks of the humerus. The reason why they call it surgical neck because fractures occur here at the surgical neck. Okay, so I got the anatomical neck and the surgical neck, and then I have these two things that protrudes at the proximal end. I can only see it better if it's actually at the anterior view of the humerus. So these are the two processes that projects at the anterior part of the humerus. The name of this projection is a bump. So I'm going to use it and call it tubercles. Okay, so I'm going to call it tubercles. The bumps that you see here, they're called tubercles. When you take a look at the femur, we're going to call it trochanter. It's the same architecture as I said. Okay, so these are the two bumps The one on the higher portion is called the greater tubercle, and the one at the lower portion is called the lesser tubercle. Okay, so you can only identify it more significant if you see it in an anterior view. So those are my tubercles here, and on the posterior view, I can only see the greater tubercle. Okay, then I'm going to go down at the distal end, but I'm going to stop here at the bottom, at the mid portion, because there's actually two processes that I see at the mid portion of the humerus. The one on the lateral side is a bump, and they call it the deltoid tuberosity. The reason why they call it the deltoid tuberosity is because the deltoid muscle starts from the shoulder and inserts at the lateral end of the bone called the humerus. So because the deltoid muscle keeps on pulling that bone, so it keeps on pulling that bone onto the lateral side. That is the deltoid muscle here. So the end of that muscle will produce this process that is going to be called the deltoid tuberosity. Okay. Remember, if that is a male bone, you can actually see that the deltoid tuberosity is actually bigger. Okay, because they always do some carrying of heavy stuff. Okay, so if it's a female, not as much. Sometimes those are the things that you actually study when you do anthropology. Determine if the humerus, the fossil, the humerus that you actually see is a male or female, okay? And you can actually use the deltoid tuberosity. The deltoid tuberosity is actually seen on the anterior and posterior and the lateral side, okay? So you see the deltoid tuberosity on each side. But there's one that you can only see at the posterior view, and that is going to be the radial groove. The radial groove is an indentation that you see in an oblique manner at the posterior mid-shaft of the humerus. And when we study the nervous system, you can actually know why there's an indentation there. We call it radial groove because there's a nerve that hugs the posterior side of the humerus, producing that indentation. That is called the radial nerve, okay? And you'll actually notice that the radial nerve is the one that hugs the mid-shaft of the humerus. Now, if you fracture the mid-shaft of the humerus, you can actually cut that radial nerve, producing paralysis through specific muscles that move the wrists, hand, and fingers. So that's the reason why we don't want to move the arms of a person that we assume there's a fracture. Okay, because remember, when there's a fracture, the bones is going to be like jagged knives. They're going to be sharp, jagged knives, and that can cut the radial nerve. And that groove is called the radial groove, where the radial nerve hugs the posterior part of the humerus. Okay, so we finish with the mid shaft. I'm going down into the distal end. Okay, remember, I have one fossa at the bottom. The posterior view, I got two fossas that is on the inferior part. Okay, so I'm going to name this fossa to be the olecranon fossa. The olecranon fossa is where the ulna will articulate in that fossa. The fossa, the olecranon process of the ulna will articulate with the olecranon fossa of the humerus. And the ulna will grab on this portion here that looks like a hinge for that joint, and that portion is called the trochlea. Okay, and we'll see that the ulna looks like a monkey wrench, so we'll grab into the trochlea, and that trochlea looks like a spool of a thread. Okay, that's the description of what a trochlea is. And then on top of that is called the olecranon fossa. Now, if you turn it anteriorly, I have two fossas. Okay, and I'm going to name the medial side. This is medial side of that fossa as your coronoid fossa. That's going to be a coronoid fossa. Okay, that's going to be a medial side. I can still see the trochlea here at the bottom. So remember, the trochlea is seen in the posterior and seen on the anterior. But this part here that looks like a round ball, this is called the capitulum. You can see it only at the anterior end, but you can never see anything at the posterior end. It's not visible here. So in the anterior distal end, you can see the trochlea, front and back, but the capitulum is only seen at the front anterior view, and you don't see it in the back, okay? And then those are the structures that I need to identify the distal end. Remember, the medial side, the two fossas here, and the medial side we call it coronoid fossa, and on the lateral side it's called the radial fossa, because there's going to be the two bones here, that is the radius and ulna, that will hide in this fossa. We'll see it later on, okay? So I now have my terminal end at the medial side. I got two of them, okay? On each side, I'm going to call it epicondyles. The one located at the medial side, right here, we call it a medial epicondyle. And the one located at the lateral side, we call it a lateral epicondyle. Remember, muscles will originate at this part when it goes into the wrist. Okay, that's why we have to identify these condyles, epicondyles. So these are the structures that we need to identify in the humeral bone. Okay, so that finish up our humerus. Now we're going down into the radius and ulna, but let's see how the radius and ulna articulates at the distal end of the humerus. So at the distal end of the humerus, you would actually see that the radius, okay, this is the head of the radius, and this is the part of the ulna. And the front part of the ulna is called the coronoid process, okay? And this is the radial head that sits on the capitulum. It actually sits like a T of a golf ball, okay? So the golf ball is the capitulum, and the T is the head of the radius, okay? So let me actually go first looking at the ulna, how it looks like. So this is an ulna. It looks like a monkey wrench. It has a notch in the middle here. And remember, we call it a trochlear notch. Why? Because it will grab onto the trochlea of the humerus. And the process located above that is called the olecranon process. And the process below the ulna is called the coronoid process. So that actually explains to you that the olecranon process of the ulna will hide at the olecranon fossa of the humerus. The coronoid process of the ulna will hide at the coronoid fossa of the humerus. Okay, so let's go back to it again at the terminal end. Okay, remember, these are the two fossas located at the distal end of the humerus, anterior view. The first thing is the head of the radius will actually hide here at the radial fossa. When you flex your elbow, the head will adhere to that fossa, and that is called the radial fossa. The reason why we call it radial fossa because of the radial head will hide in that fossa. Now here is going to be called the coronoid fossa. And the reason why they call it a coronoid fossa, because the coronoid process of the ulna, when you flex your elbow, okay, so when you flex your elbow, it's going to hide at the coronoid fossa of the humerus, okay? So they actually name it based on the process in the fossas, okay? So that's how it looks like when it hides at the elbow, okay? So I'm going to move forward and take a look at the bones. Remember, of the radius and ulna. So at the distal end of the radius, you got the radial head. And at the at the proximal end of the radial bone, you have the radial head. And this is called the radial neck. And then the bump that you see here, which only exists at the anterior view, that is called the radial tuberosity. Okay, you can feel that bump when you feel the anterior part of your elbow. Okay, so that is called the radial tuberosity. Remember, the bone is always follow the thumb. Wherever your thumb is located, the bone that follows that is the radial bone. The bone that follows the pinky, when you see the pinky, the bone that follows that is going to be the ulna, where the pinky is. Okay, so on the medial side of the forearm, is going to be the ulna. That's where your pinky is. Remember, anatomical position, palms facing forward. So the thumb side is the radial bone. The pinky side is the ulnar bone. And the pinky side is on the medial side in anatomical position. Okay, so what are the two processes that are located at the ulna? The one at the back is called the olecranon process. This is the olecranon process. You can feel it when you flex your elbow. This bone that you feel the edge of the elbow, that is called the olecranon process. Okay, that's going to be the olecranon process. And then at the front of the proximal end of the ulna is going to be called the coronoid process. Okay, so the coronoid process is located at the inner part of the ulna. Okay, that will be the coronoid process. Okay, and the notch is actually called the trochlear notch. Okay, that's the one that grabs onto the trochlea of the humerus. Right. So we finish with the structures that needs to be identified at the proximal end of both radius and ulna. There's nothing much to identify on the mid portion of the two bones. At the distal end, there's two structures that you would actually want to identify. The bumps that you see onto this part here of the radius, since radius is on the lateral side, this will be the styloid process of the radius. Sometimes we just call it the lateral radial process. Lateral styloid process. I didn't even have to say it's the radial process. Lateral styloid process. So it's understood that this is actually the bump that you see here at the lateral side, at the distal end of the forearm. So you can feel that bump when you feel the part here at your wrist, just below the wrist. These are the bumps called the styloid process. Since we're following the thumb, that is where my lateral styloid process could be located at. Remember, the thumb is on the lateral side of anatomical position. So what is the bump that you see here at the medial side? That bump is called the styloid process of the ulna. Okay? The styloid process of the ulna is this bump that you see on the medial side. Okay? And that is sometimes just termed as the medial styloid process. The medial styloid process. Okay? So I'm giving you a hint now. On the exam, I'm asking what bone has the medial styloid process? And what bone has the lateral styloid process? So the answer would be the medial styloid process, the bone at the distal end of the ulna. That comes from the ulna. The bone that has the lateral styloid process is at the distal end of the radius. Okay? So that's another name for that. Instead of saying styloid process of radius, that will be the lateral styloid process. Okay? Medial styloid radius medial styloid process of the ulna, that will be the medial styloid process. The same thing. Okay? So we finish with everything that we see have to identify the radius and ulna. Now, if you notice, this creates a letter U. Okay? So what happens here? Because remember, this will be similar to your ankle. It also will create a letter U, except that the bump, instead of calling the styloid process at the leg, at the distal end, we call it a lateral malleolus. We call it lateral malleolus and medial malleolus. Okay? Medial malleolus is actually going to be at the part of the tibia. And lateral malleolus is at the part of the fibula. Remember, I told you the architecture is quite the same. And then medial and lateral malleolus, also with the lateral styloid process and medial styloid process, they create that letter U. Because this is where the wrist would sit. Okay? And again, the wrist is called carpal bones. Okay, that allows you to wave this way on your wrist because that is called the carpal bones, and it creates a letter U down here at the wrist, so it lets you wave where the carpal bones are. Okay, and the next bone is going to be the wrist. Okay, so we're going to take a look at the wrist. Okay, and that's going to be the carpal bones. Now, there's actually 4 bones on each row. There's actually 2 rows on the wrist. So total of 8 bones. Okay. So this is what your wrist looks like. Okay. Remember, you should position your thumb and the pinky in the right way. The thumb is positioned in the lateral portion. The pinky is positioned in the medial portion. Remember anatomical position, palms facing forward. The thumb, the thumb is going away from the center, so it's lateral. The pinky is towards the medial side, okay? So it's on the medial side, okay? So now we're going to take a look at the 4 bones at the first row and the 4 bones at the second row. These are your carpal bones. We can name each one. And then if you notice, the styloid processes of the radius and ulna creates this letter U so that it cradles the carpal bones. Okay, this is the radius and this is the styloid process of the radius, okay, which is the lateral styloid process. This is the ulna, so this is the medial styloid process located at the ulna, okay. So they actually create the letter U to cradle the carpal bones. So we're going to identify the bones. So remember, we're going to identify systematically from thumb to pinky. From thumb to pinky. In other words, we're identifying the carpal bones from lateral to medial. Okay? Thumb is at the lateral part of your hand. Okay? Pinky is a medial part of your hand in anatomical position. So we're going to identify the first 4 bones here, and then after that, we're going to identify the next 4 bones on top. And there's a mnemonics to that, okay? So the mnemonics is going to be the first proximal row, just close to the radius in the ulna, from lateral to medial. We first identify the first 4 bones. The mnemonics for this 4 bones is called Sally left the party. That is the first 4 bones. From thumb to pinky, lateral to medial. Sally scaphoid, left lunate, the triquetral party pisiform. Okay? So those are the first 4 bones on the proximal row. Always start thumb to pinky. Okay? If this is a thumb, I'm going to say Sally left the party. That's the first 4 bones of the wrist bone. What is Sally? Scaphoid, left, lunate, the triquetral party pisiform. Those are the first 4 bones. Okay. Now I'm going to go to the next 4 bones, which is the distal row. Okay. So I'm going to use the distal row for the next 4 bones. That's going to be my mnemonics. Okay. Let me actually see if I can remove everything and then start off again. Okay. So the next 4 is going to be to take Carmen home. Again, thumb to pinky, lateral to medial. What is 2? Trapezium, take, trapezoid, Carmen, capitate, home, hamlet. Okay, so those are the 4 distal row. Again, thumb to pinky or lateral to medial. Okay, so we're going to look at the bone in the wrist. This is actually the bone on the wrist. And we'll identify it based on, okay, I'm going to try to erase the label so we can start off with the first 4 on the proximal row. Again, thumb to pinky, okay, from thumb to pinky. The phalanges of the thumb, there's only 2 of them. The fingers, there's only 2 bones. And the other has 3. So you know that it's a thumb because it only has 2 phalanges. Okay. So we're going to start with thumb to pinky. Sally left the party. Okay, thumb to pinky. Sally is scaphoid. Scaphoid means it looks like a scallop. Okay, this is exactly what a scaphoid is. Take a look at the shape of the scaphoid. It looks like a scallop. It's curved. That's actually another way to actually identify that part of the wrist bone. Okay, a scallop. It looks like a curved structure, and that is called your scaphoid. Okay, so if you know where the scaphoid is based on the shape, you know this is going to be lunate, this is going to be triquetrum, and this is going to be pisiform. Okay, you're looking at the anterior view. Anterior view. Now, if I'm looking at my anterior view of the palm, and I'm reading it thumb to pinky. Okay, but if you turn it, I'm looking at the posterior view of my hand. This is the posterior view of your hand. Okay, so what's wrong with this? I have thumb to pinky again. Sally left the. I don't see pisiform or party, because if you take a look at the anterior view, pisiform is sitting on triquetrum. So it's hidden from the posterior view. Pisiform is sitting in front of triquetrum. So you don't see pisiform on this posterior view of the hand. But you're still naming it from thumb to pinky. But you're looking at the posterior part of the hand. I don't see pisiform here. Okay. Now the next 4 row, okay, I'm looking at the anterior view again. I'm looking at my palms. I'm identifying thumb to pinky. This is going to be to take Carmen home. So what is to? Trapezium. What is take? Trapezoid. It looks alphabetical. I first, then O next. Okay. Trapezium, trapezoid, capitate, and then hammer. Hammer means hammer. A hammer. It looks like a hammer on that bone. Okay. So that's actually thumb to pinky again. If you take a look at the posterior view, you still see the 4 bones. To thumb to pinky, take Carmen home. Okay, so those are the 8 bones at your wrist. Okay, again, Sally left the party. That's the proximal row, and then the distal row is to take Carmen home. Always thumb to pinky. Okay, thumb to pinky. All right. So when finished with the wrist bone, okay, what we are left with is going to be the metacarpals. This is metacarpal 1 for the thumb, metacarpal 2 for the index finger, metacarpal 3 for the middle finger, metacarpal 4 for the ring finger, and metacarpal 5 for the pinky. So those are the 5 metacarpal bones. Remember, the metacarpals is where the web of your hand covers it. So the metacarpals are actually at the tip of the web of your hand. And at the end of that is going to be the phalanges. These are the fingers. Okay? These are your fingers at the end of that. There's 5. Okay? Each one usually has 3. So each one of these has 3. The part here is called the distal. This is the middle, and this is the proximal. So the phalanges are distal, the middle, and the proximal phalange. There's 3 on the 4 fingers, except for the thumb. The thumb, there's only 2. We only have distal and proximal phalange. Okay, I'm sorry, the palm should be going down here. Okay, so those are the bones of the upper extremity. Okay, remember, we started out from the pectoral girdle between the clavicle and the scapula. Okay, and then we went down to take a look at the humerus, And then after the humerus, we looked at the radius and the ulna. And after the radius and ulna, we look at your wrist bone. And after the wrist bone, we look at your metacarpals on the palm. And then after the metacarpals, we look at your phalanges. And those are the whole bone of the upper extremity, the girdle and the upper limbs. Okay? So that actually finishes up our lecture for this part here. Okay? So this is the summary of your upper limbs, the pectoral girdle, the two bones on top, the humerus, the radius and ulna of the forearm, the wrist bone called the carpal bones, the hand bone called the metacarpal, and the fingers are called the phalanges.
First, look at the girdles between the scapula and the clavicle. Those are the two parts of the girdle. So this is the clavicle, and this is the scapula, and the scapula articulates through the acromion process. So this is the acromion process of the scapula. So at the back, you can still see the scapula, the clavicle and the scapula here. Okay, this is the clavicle. We have the acromial end. Acromial end looks like a beak, the duck's beak, flat, and the sternal end is actually blunt. Okay. Then the cunoid tubercle is the inferior portion of the clavicle. That's called the cunoid tubercle. And this is the scapula, anterior part, subscapular fossa. There's no spine in the anterior part. Lateral part is going to be the glenoid cavity. And this is from the anterior side called the coracoid process. Posterior is the acromion process. Okay. Then the borders, medial border, and this is lateral border, superior border, and the superior angle, inferior angle, and the lateral angle. Okay. And the little bump you see here is actually called the infraglenoid tubercle. Infra, below, glenoid cavity. It's a bump, tubercle, infraglenoid tubercle. Here's the lateral view. I see the glenoid fossa, where the glenoid cavity is. In the front process called the coracoid, the one in the back, where it actually connects with the spine, acromion process, okay? And the bump here is infraglenoid tubercle. And this is the posterior view. You got the scapular spine. It ends to become the acromion process. The one in front is the coracoid process. Okay. Then this is going to be the glenoid cavity. And this is going to be the supraspinous fossa. Supra above the spine. So what's below the spine is going to be the infraspinous fossa. So we're going to the upper limbs, okay? So just remember proximal, distal. And again, I see the two fossas here. So this is not my posterior humerus. This is anterior. So the two fossa, radial fossa, and the coronoid fossa. The one on the distal end, and the two condyles, we call it capitulum. It looks like a ball. And the trochlea looks like the spool of a thread. Remember, the capitulum is where the radial bone sits, and the trochlea is where the ulna grounds. Okay, and let's finish up the proximal end. We got the greater tubercle, the lesser tubercle. Then we have the head and the anatomical neck beside the head, and the cervical neck. The reason why surgical neck is the fractures. To the lateral side is the deltoid tuberosity. Okay, so I'm looking at the anterior, so I'm not going to see the radial groove. Then on the distal end, the epicondyles, medial epicondyle and the lateral epicondyle. Okay, so that's actually at the humerus. So looking at the distal end of the humerus, I see the capitulum, round ball. I see the trochlea, the spool of a thread, and I see the two fossa above the capitulum, radial fossa, Then medial is coronoid fossa, and then the epicondyle, lateral epicondyle, and medial epicondyle. Okay. Then here now this is the distal posterior view because I see only one fossa. That is called the olecranon fossa, and I see the two ends. Okay. The epicondyle. Just remember the medial epicondyle is more protruding outward compared to the lateral epicondyle. The medial epicondyle is more protruding outward. Okay? And the only thing I see here is the trochlea, the spool of a thread where the ulna grabs. And this is where the two fossas are, anterior view. Radial fossa, coronoid fossa, capitulum, and the trochlea. The ulna grabs the trochlea, the radial head grabs the capitulum. Okay, remember the radius is at the lateral side, and the medial side is the ulna. And if you see that medial epicondyle, it's more protruding outward. Okay, medial epicondyle of the humerus. Now this is how it looks like a posterior view. I only see one fossa. That is going to be called the olecranon fossa. And then the olecranon process of the ulna is seen here. Okay, so remember that's the olecranon process of the ulna hides at the olecranon fossa of the humerus on extension, on elbow extension. Then medial epicondyle more protruding upward. Lateral epicondyle flatter. Okay. This is the radius, and I see the radial tuberosity, so I'm looking at it at the anterior view. The ulna, I see the two processes, olecranon and your coronoid. So this is anterior view. Okay, the distal end, the styloid process here. This is the styloid process of the radius, styloid process of the ulna. It creates that letter U at the distal end. Okay, this is what the ulna looks like. It looks like a monkey wrench. This is the olecranon process. That's the one that you feel at the back. Okay, when you actually feel your elbow, that's the olecranon process of the ulna. Okay, the front is the coronoid process, and this is called the trochlear notch. Distal end, styloid process. Okay, styloid process. And take a look at the ulna. The head is actually upside down. It's opposite. Radius, the head was here. Radial head is actually proximal. The ulnar head is distal. Okay. Right, then this is a trochlear notch, olecranon process, coronoid process. This is the radial tuberosity, the front, the radial head, radial neck. Then go down the styloid process of the radius. The radial head. Remember I said radial head is proximal, ulnar head is distal. Then this is the neck and the radial tuberosity. Okay, down a picture of the radius, similar to what we actually identified. Then same as a picture of the radius. Okay, radial tuberosity is anterior. Okay, but we're looking at the medial view. Okay, now this is going to be the carpal bones. First, let's finish up with the metacarpals. These are your metacarpals, and these are your phalanges. 3 on each, except for the thumb, there's only 2. So they're called proximal, middle, and distal. Here you only have the proximal and distal for the thumb. Okay, so the first thing is the first 4 rows. Okay, so I'm going to actually take a look at my first 4 rows at the bones of the hand. So this is the right bone, right of the hand, anterior view. So I should actually be able to see my 4 bones. Okay, scaphoid, looks, it's curved. It's curved, and that's going to be scaphoid, Sally, left, lunate, this bone here, triquetrum, and then the one on top of it is pisiform. So sometimes I actually say that pisiform is pissing off triquetrum. That's why triquetrum is trying to quit. Okay, so those are the four. I see the four on the anterior of my palm, and the other four is going to be this. Okay, again, to take Carmen home. To take Carmen home. Thumb to pinky always. Okay, so Sally left the party to take Carmen home. Okay, two is trapezium, then trapezoid, Carmen is capitate, and home is hammock. Okay, so those are the three the carpal bones. Okay, again, trapezium, two, take trapezoid, Carmen, it's going to be capitate, home, hammock. Okay. Then this is Sally, scaphoid, left the party.